BPSC BPS 17, Medical Officer and Lady Medical Officer. Paper 4. 100 most repeated questions taken from authentic past papers. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. Pulsus bisferiens is characteristic of Option A. Mitral stenosis. Option B. Pure aortic regurgitation. Option C. Aortic stenosis. Option D. Tricuspid regurgitation. The correct answer is option B. Pure aortic regurgitation. Let's go through the options. Mitral stenosis. Mitral stenosis gives a low volume pulse. Aortic stenosis. Aortic stenosis gives a slow rising pulse. Tricuspid regurgitation. Tricuspid regurgitation affects the venous pulse. And the correct answer is pure aortic regurgitation. Pulsus bisferiens, a double pulse, occurs in pure aortic regurgitation. So, the right answer is option B. Pure aortic regurgitation. Question 2. Pulsus bigeminus is a sign of Option A. Atrial fibrillation. Option B. Hypertrophic obstructive cardiomyopathy. Option C. Complete heart block. Option D. Aortic stenosis. The correct answer is option B. Hypertrophic obstructive cardiomyopathy. Let's go through the options. Atrial fibrillation. Atrial fibrillation is irregularly irregular. Complete heart block. Complete heart block gives a slow regular pulse. Aortic stenosis. Aortic stenosis gives a slow rising pulse. And the correct answer is hypertrophic obstructive cardiomyopathy. Paired beats, pulsus bigeminus, are linked here with hypertrophic obstructive cardiomyopathy. So, the right answer is option B. Hypertrophic obstructive cardiomyopathy. Question 3. Hemoptysis is a recognized feature of which valvular lesion? Option A. Aortic stenosis. Option B. Mitral stenosis. Option C. Mitral regurgitation. Option D. Tricuspid stenosis. The correct answer is option B. Mitral stenosis. Let's go through the options. Aortic stenosis. Aortic stenosis gives syncope and angina. Mitral regurgitation. Mitral regurgitation gives dyspnea. Tricuspid stenosis. Tricuspid stenosis gives venous congestion. And the correct answer is mitral stenosis. Mitral stenosis raises pulmonary venous pressure, causing hemoptysis. So, the right answer is option B. Mitral stenosis. Question 4. Mitral valve prolapse is most commonly associated with Option A. Mitral regurgitation. Option B. Mitral stenosis. Option C. Aortic stenosis. Option D. Tricuspid regurgitation. The correct answer is option A. Mitral regurgitation. Let's go through the options. Mitral stenosis. It does not cause stenosis. Aortic stenosis. Aortic stenosis is unrelated. Tricuspid regurgitation. Tricuspid regurgitation is unrelated. And the correct answer is mitral regurgitation. Mitral valve prolapse most often leads to mitral regurgitation. So, the right answer is option A. Mitral regurgitation. Question 5. The severity of hypertension is best judged by the Option A. Systolic pressure. Option B. Mean arterial pressure. Option C. Pulse pressure. Option D. Diastolic pressure. The correct answer is option D. Diastolic pressure. Let's go through the options. Systolic pressure. Systolic pressure varies with many factors. Mean arterial pressure. Mean pressure is not the classic measure. Pulse pressure. Pulse pressure reflects arterial stiffness. And the correct answer is diastolic pressure. The diastolic pressure best judges the severity of hypertension. So, the right answer is option D. Diastolic pressure. Question 6. The commonest cause of secondary hypertension is option A. Conn syndrome. Option B. pheochromocytoma. Option C. Chronic pyelonephritis. Option D. coarctation. The correct answer is option C. Chronic pyelonephritis. Let's go through the options. Conn syndrome. Conn syndrome is uncommon. Pheochromocytoma. Pheochromocytoma is rare. Coarctation. Coarctation is uncommon. And the correct answer is chronic pyelonephritis. Renal disease, chronic pyelonephritis, is the commonest cause of secondary hypertension. So, the right answer is option C. Chronic pyelonephritis. Question 7. Digoxin toxicity is aggravated by option A. Hyperkalemia. Option B. Hypokalemia. Option C. Hypernatremia. Option D. Hypercalcemia. The correct answer is option B. Hypokalemia. Let's go through the options. Hyperkalemia. Hyperkalemia does not worsen it in this way. Hypernatremia. Hypernatremia is unrelated. Hypercalcemia. Hypercalcemia is only a minor factor. And the correct answer is hypokalemia. Hypokalemia potentiates digoxin toxicity. So, the right answer is option B. Hypokalemia. Question 8. Hypokalemia produces which ECG change? Option A. Tall T waves. Option B. Prolonged QT with scent depression. Option C. Shortened QT. Option D. Delta wave. The correct answer is option B. Prolonged QT with scent depression. Let's go through the options. Tall T waves. Tall T waves are seen in hyperkalemia. Shortened QT. A short QT is hypercalcemia. Delta wave. A delta wave is Wolff-Parkinson-White. And the correct answer is prolonged QT with scent depression. Hypokalemia gives scent depression, flat T waves, U waves and a long QT. So, the right answer is option B. Prolonged QT with scent depression. Question 9. Generalized muscle weakness is a classic feature of option A. Hypernatremia. Option B. Hypokalemia. Option C. Hyperchloremia. Option D. Hypermagnesemia. The correct answer is option B. Hypokalemia. Let's go through the options. Hypernatremia. Hypernatremia gives thirst and confusion. Hyperchloremia. Hyperchloremia is unrelated. Hypermagnesemia. Hypermagnesemia is uncommon. And the correct answer is hypokalemia. Hypokalemia causes generalized muscle weakness. So, the right answer is option B. Hypokalemia. Question 10. TENI occurs in association with option A. Hyperkalemia. Option B. Acidosis. Option C, alkalosis. Option D, hypernatremia. The correct answer is option C, alkalosis. Let's go through the options. Hyperkalemia. Hyperkalemia is unrelated. Acidosis. Acidosis actually reduces tanning. Hypernatremia. Hypernatremia is unrelated. And the correct answer is alkalosis. Alkalosis lowers the ionized calcium, causing tanning. So, the right answer is option C. Alkalosis. Question 11. Sustained diarrhea characteristically produces. Option A, respiratory acidosis. Option B, metabolic alkalosis. Option C, metabolic acidosis. Option D, respiratory alkalosis. The correct answer is option C, metabolic acidosis. Let's go through the options. Respiratory acidosis. Respiratory acidosis is from lung disease. Metabolic alkalosis. Metabolic alkalosis is from vomiting. Respiratory alkalosis. Respiratory alkalosis is from hyperventilation. And the correct answer is metabolic acidosis. Diarrhea loses bicarbonate, causing metabolic acidosis. So, the right answer is option C. Metabolic acidosis. Question 12. Increased hemolysis is reflected by a raised. Option A, amylase. Option B, alkaline phosphatase. Option C, lactate dehydrogenase. Option D, creatine kinase. The correct answer is option C, lactate dehydrogenase. Let's go through the options. Amylase. Amylase reflects the pancreas. Alkaline phosphatase. Alkaline phosphatase reflects bile and bone. Creatine kinase. Creatine kinase reflects muscle. And the correct answer is lactate dehydrogenase. Lactate dehydrogenase rises with hemolysis. So, the right answer is option C. Lactate dehydrogenase. Question 13. Reticulocytosis is not expected in. Option A, aplastic anemia. Option B, hemolytic anemia. Option C, acute blood loss. Option D, treated iron deficiency. The correct answer is option A, aplastic anemia. Let's go through the options. Hemolytic anemia. Hemolysis raises reticulocytes. Acute blood loss. Acute blood loss raises them. Treated iron deficiency. Treated iron deficiency raises them. And the correct answer is aplastic anemia. Aplastic anemia has a failing marrow, so no reticulocytosis, the exception. So, the right answer is option A. Aplastic anemia. Question 14. Increased HbA2 with raised HbF indicates. Option A, G6PD deficiency. Option B, sickle cell disease. Option C, iron deficiency. Option D, beta thalassemia. The correct answer is option D, beta thalassemia. Let's go through the options. G6PD deficiency. G6PD deficiency has a normal electrophoresis. Sickle cell disease. Sickle cell disease shows HbS. Iron deficiency. Iron deficiency lowers the indices, not HbA2. And the correct answer is beta thalassemia. Raised HbA2 and HbF indicate beta thalassemia. So, the right answer is option D. Beta thalassemia. Question 15. Spontaneous thrombosis is a recombinant. Option A. Methotrexate. Option B. Asparaginase. Option C. Vincristine. Option D. Bleomycin. The correct answer is option B. Asparaginase. Let's go through the options. Methotrexate. Methotrexate causes mucositis. Vincristine. Vincristine causes neuropathy. Bleomycin. Bleomycin causes lung fibrosis. And the correct answer is asparaginase. Asparaginase lowers antithrombin, causing thrombosis. So, the right answer is option B. Asparaginase. Question 16. The drug of choice in multiple myeloma is option A. Cytarabine. Option B. Chlorambucil. Option C. Busulfan. Option D. Melphalan. The correct answer is option D. Melphalan. Let's go through the options. Cytarabine. Cytarabine is for leukemia. Chlorambucil. Chlorambucil is for chronic lymphocytic leukemia. Busulfan. Busulfan is for chronic myeloid leukemia. And the correct answer is Melphalan. Melphalan is a mainstay in multiple myeloma. So, the right answer is option D. Melphalan. Question 17. Alkaline phosphatase rises markedly in option A. Obstructive jaundice. Option B. Hemolytic jaundice. Option C. Acute hepatitis only. Option D. Gilbert syndrome. The correct answer is option A. Obstructive jaundice. Let's go through the options. Hemolytic jaundice. Hemolytic jaundice raises unconjugated bilirubin. Acute hepatitis only. Acute hepatitis raises the transaminases more. Gilbert syndrome. Gilbert syndrome has a normal alkaline phosphatase. And the correct answer is obstructive jaundice. Alkaline phosphatase rises markedly in obstructive jaundice. So, the right answer is option A. Obstructive jaundice. Question 18. Water intoxication is characterized by option A. Fever. Option B. Rapid pulse. Option C. Hypertension. Option D. Slow pulse. The correct answer is option D. Slow pulse. Let's go through the options. Fever. Fever is not typical. Rapid pulse. The pulse slows, it does not raise. Hypertension. Blood pressure is not raised. And the correct answer is slow pulse. Water intoxication gives a slow pulse, headache and confusion. So, the right answer is option D. Slow pulse. Question 19. A patient upright for a prolonged period develops vasovagal syncope due to option A. Hypoglycemia. Option B. Cerebral ischemia. Option C. Hypoxia. Option D. Hypercapnia. The correct answer is option B. Cerebral ischemia. Let's go through the options. Hypoglycemia. Hypoglycemia is a separate cause. Hypoxia. Hypoxia is not the mechanism. Hypercapnia. Hypercapnia is not the mechanism. And the correct answer is cerebral ischemia. Vasovagal syncope is transient cerebral ischemia from a fall in blood pressure. So, the right answer is option B. Cerebral ischemia. Question 20. Hypercalcemia of malignancy is most often mediated by Option A. Phosphate loss. Option B. Calcitonin. Option C. Vitamin D deficiency. Option D. Parathyroid hormone-related peptide. The correct answer is option D. Parathyroid hormone-related peptide. Let's go through the options. Phosphate loss. Phosphate loss is a consequence, not the mediator. Calcitonin. Calcitonin lowers calcium. Vitamin D deficiency. Vitamin D deficiency lowers calcium. And the correct answer is parathyroid hormone-related peptide. Parathyroid hormone-related peptide mediates hypercalcemia of malignancy. So, the right answer is option D. Parathyroid hormone-related peptide. Question 21. A Safena varix is most likely to be confused with A. Option A. Psoas abscess. Option B. Inguinal hernia. Option C. Lymph node. Option D. Femoral hernia. The correct answer is option D. Femoral hernia. Let's go through the options. Psoas abscess. A psoas abscess is deeper. Inguinal hernia. An inguinal hernia is above the ligament. Lymph node. A lymph node is firm. And the correct answer is femoral hernia. A Safena varix is confused with a femoral hernia, but it has a cough impulse and disappears on line. So, the right answer is option D. Femoral hernia. Question 22. Milroy disease is a lymphedema that is Option A. Traumatic. Option B. Infective. Option C. Familial. Option D. Malignant. The correct answer is option C. Familial. Let's go through the options. Traumatic. It is not traumatic. Infective. It is not infective. Malignant. It is not malignant. And the correct answer is familial. Milroy disease is a familial congenital lymphedema. So, the right answer is option C. Familial. Question 23. Rest pain in peripheral vascular disease is felt in the Option B. Foot. Option C. Thigh. Option D. Buttock. The correct answer is option B. Foot. Let's go through the options. Calf. The calf hurts in claudication. Thigh. The thigh is not typical. Buttock. Buttock pain suggests aortoiliac disease. And the correct answer is foot. Rest pain of critical ischemia is felt in the foot, worse at night. So, the right answer is option B. Foot. Question 24. Berger disease characteristically affects Option A. The aorta. Option B. Small and medium arteries of the limbs. Option C. Renal arteries. Option D. Cerebral vessels. The correct answer is option B. Small and medium arteries of the limbs. Let's go through the options. The aorta. The aorta is spared. Renal arteries. The renal arteries are spared. Cerebral vessels. The cerebral vessels are spared. And the correct answer is small and medium arteries of the limbs. Berger disease affects the small and medium arteries of the limbs. So, the right answer is option B. Small and medium arteries of the limbs. Question 25. Lumbar sympathectomy is of most value in Option A. Distal ischemia affecting the skin of the toes. Option B. Claudication. Option C. Aneurysm. Option D. Varicose veins. The correct answer is option A. Distal ischemia affecting the skin of the toes. Let's go through the options. Claudication. It does not relieve claudication well. Aneurysm. An aneurysm needs repair. Varicose veins. Varicose veins are treated by ablation. And the correct answer is distal ischemia affecting the skin of the toes. It helps distal skin ischemia of the toes by vasodilation. So, the right answer is option A. Distal ischemia affecting the skin of the toes. Question 26. Malunion of a fracture means the fracture has united. Option A. With infection. Option B. Not at all. Option C. In a position of deformity. Option D. With shortening only. The correct answer is option C. In a position of deformity. Let's go through the options. With infection. Union with infection is a separate problem. Not at all. Non-union means it has not united at all. With shortening only. Shortening is only one aspect. And the correct answer is in a position of deformity. Malunion means the fracture has united in a deformed position. So, the right answer is option C. In a position of deformity. Question 27. A transverse fracture of the patella typically. Option A. Unites without treatment. Option B. Always impacts. Option C. Does not impact. Option D. Needs no immobilization. The correct answer is option C. Does not impact. Let's go through the options. Unites without treatment. It does not unite without treatment. Always impacts. It does not impact. Needs no immobilization. It needs fixation. And the correct answer is does not impact. A transverse patellar fracture does not impact, the fragments are pulled apart. So, the right answer is option C. Does not impact. Question 28. Treatment of a severely comminuted patellar fracture is Option A. Wiring. Option B. Plating. Option C. Patelectomy. Option D. Conservative. The correct answer is option C. Patelectomy. Let's go through the options. Wiring. Wiring suits a transverse fracture. Plating. Plating is not used. Conservative. Conservative treatment fails for comminution. And the correct answer is patelectomy. A severely comminuted patella is treated by patelectomy. So, the right answer is option C. Patelectomy. Question 29. Slipped femoral epiphysis typically occurs in Option A. Overweight boys aged 10 to 18 years. Option B. Thin girls under 5 years. Option C. Elderly men. Option D. Neonates. The correct answer is option A. Overweight boys aged 10 to 18 years. Let's go through the options. Thin girls under 5 years. Not thin young girls. Elderly men. Not the elderly. Neonates, not neonates. And the correct answer is overweight boys aged 10 to 18 years. It occurs in overweight adolescent boys. So, the right answer is option A. Overweight boys aged 10 to 18 years. Question 30. Idiopathic scoliosis is defined as a lateral curvature with option A. Kyphosis only. Option B. No rotation. Option C. Rotation of the spine. Option D. Fixed flexion. The correct answer is option C. Rotation of the spine. Let's go through the options. Kyphosis only. Kyphosis is in a different plane. No rotation. There is rotation, not none. Fixed flexion. Fixed flexion is unrelated. And the correct answer is rotation of the spine. Idiopathic scoliosis is a lateral curve with vertebral rotation. So, the right answer is option C. Rotation of the spine. Question 31. Trigger finger is due to option A. Tendon rupture. Option B. Nerve entrapment. Option C. Joint arthritis. Option D. Tenosynovitis. The correct answer is option D. Tenosynovitis. Let's go through the options. Tendon rupture. The tendon is not ruptured. Nerve entrapment. It is not nerve entrapment. Joint arthritis. It is not joint arthritis. And the correct answer is tenosynovitis. Trigger finger is a stenosing tenosynovitis of the flexor tendon. So, the right answer is option D. Tenosynovitis. Question 32. Pseudarthrosis describes option A. An infected joint. Option B. A dislocated joint. Option C. A false joint at an ununited fracture. Option D. A fused joint. The correct answer is option C. A false joint at an ununited fracture. Let's go through the options. An infected joint. An infected joint is different. A dislocated joint. A dislocation is different. A fused joint. A fused joint is ankylosis. And the correct answer is a false joint at an ununited fracture. Pseudarthrosis is a false joint at an ununited fracture. So, the right answer is option C. A false joint at an ununited fracture. Question 33. The commonest site of a hydatidiform mole complication is option A. Lung metastasis. Option B. Bone metastasis. Option C. Brain metastasis. Option D. Liver metastasis. The correct answer is option A. Lung metastasis. Let's go through the options. Bone metastasis. Bone spread is uncommon. Brain metastasis. Brain spread is uncommon. Liver metastasis. Liver spread is uncommon. And the correct answer is lung metastasis. The lung is the commonest site of metastasis in molar disease. So, the right answer is option A. Lung metastasis. Question 34. Placenta increta describes invasion into the option A. Endometrium only. Option B. Myometrium. Option C. Serosa. Option D. Rectum. The correct answer is option B. Myometrium. Let's go through the options. Endometrium only. The endometrium alone is the normal plane. Serosa. The serosa is percreta. Rectum. The rectum is percreta. And the correct answer is myometrium. Placenta increta invades into the myometrium. So, the right answer is option B. Myometrium. Question 35. Uterine artery embolization is used in the management of option A. Fibroid uterus, option B. Ovarian cyst, option C. Endometriosis, option D. Cervical polyp. The correct answer is option A. Fibroid uterus. Let's go through the options. Ovarian cyst. An ovarian cyst is not treated this way. Endometriosis. Endometriosis is treated differently. Cervical polyp. A cervical polyp is simply removed. And the correct answer is fibroid uterus. Uterine artery embolization shrinks fibroids. So, the right answer is option A. Fibroid uterus. Question 36. Ovarian tumors spread mainly by option A. Hematogenous spread, option B. Exfoliation of malignant cells, option C. Direct invasion only, option D. Lymphatics only. The correct answer is option B. Exfoliation of malignant cells. Let's go through the options. Hematogenous spread. Hematogenous spread is late. Direct invasion only. Direct invasion alone is not it. Lymphatics only. Lymphatics alone is not it. And the correct answer is exfoliation of malignant cells. Ovarian cancer spreads mainly by transcoelomic exfoliation of cells over the peritoneum. So, the right answer is option B. Exfoliation of malignant cells. Question 37. Pseudomyxoma peritonei arises from A. Option A. Mucinous cystadenoma, option B. serous cystadenoma, option C. dermoid cyst, option D. fibroma. The correct answer is option A. Mucinous cystadenoma. Let's go through the options. Serous cystadenoma. A serous cystadenoma is watery. Dermoid cyst. A dermoid has skin elements. Fibroma. A fibroma is solid. And the correct answer is mucinous cystadenoma. Pseudomyxoma peritonei arises from a mucinous cystadenoma of ovary or appendix. So, the right answer is option A. Mucinous cystadenoma. Question 38. Teca lutein cysts are characteristically associated with option A. Hydatidiform mole, option B. Endometriosis, option C. Fibroid, option D. Ectopic pregnancy. The correct answer is option A. Hydatidiform mole. Let's go through the options. Endometriosis. Endometriosis gives chocolate cysts. Fibroid. A fibroid is unrelated. Ectopic pregnancy. An ectopic does not cause them. And the correct answer is hydatidiform mole. Teca lutein cysts occur with a hydatidiform mole driven by high HCG. So, the right answer is option A. Hydatidiform mole. Question 39. The commonest cause of female infertility is option A. Uterine anomaly, option B. Tubal block, option C. Polycystic ovary syndrome, option D. Cervical factor. The correct answer is option C, polycystic ovary syndrome. Let's go through the options. Uterine anomaly. A uterine anomaly is uncommon. Tubal block. Tubal block is a cause but not the commonest here. Cervical factor. A cervical factor is uncommon. And the correct answer is polycystic ovary syndrome. Polycystic ovary syndrome, causing anovulation, is the commonest cause of female infertility. So, the right answer is option C. Polycystic ovary syndrome. Question 40. The lower vagina drains to which lymph nodes? Option A, obturator. Option B, internal iliac. Option C, paraortic. Option D, superficial inguinal. The correct answer is option D, superficial inguinal. Let's go through the options. Obturator. Obturator nodes drain the cervix. Internal iliac. Internal iliac nodes drain the upper vagina. Paraortic. Paraortic nodes drain the ovary. And the correct answer is superficial inguinal. The lower vagina drains to the superficial inguinal nodes. So, the right answer is option D. Superficial inguinal. Question 41. The Wolffian duct in the female normally forms. Option A, the fallopian tube. Option B, the uterus. Option C, no definite structure. Option D, the upper vagina. The correct answer is option C, no definite structure. Let's go through the options. The fallopian tube. The fallopian tube is Mullerian. The uterus. The uterus is Mullerian. The upper vagina. The upper vagina is Mullerian. And the correct answer is no definite structure. In the female, the Wolffian duct regresses and forms no definite structure. So, the right answer is option C. No definite structure. Question 42. Colposcopy is used for all of the following except. Option A, suspected dysplasia. Option B, abnormal smear. Option C, cervical lesion. Option D, pelvic endometriosis. The correct answer is option D, pelvic endometriosis. Let's go through the options. Suspected dysplasia. Colposcopy is used for suspected dysplasia. Abnormal smear. And for an abnormal smear. Cervical lesion. And for a cervical lesion. And the correct answer is pelvic endometriosis. Pelvic endometriosis is assessed by laparoscopy, not colposcopy, the exception. So, the right answer is option D. Pelvic endometriosis. Question 43. Subtotal hysterectomy means that which structure is retained? Option A, ovaries only. Option B, uterine cervix. Option C, fallopian tubes only. Option D, body of uterus. The correct answer is option B, uterine cervix. Let's go through the options. Ovaries only. The ovaries relate to oophorectomy. Fallopian tubes only. The tubes are separate. Body of uterus. The body of the uterus is removed. And the correct answer is uterine cervix. Subtotal hysterectomy leaves the cervix behind. So, the right answer is option B. Uterine cervix. Question 44. Bartholin glands are situated in the. Option A, perineal body. Option B, cervix. Option C, uterus. Option D, vagina. The correct answer is option D, vagina. Let's go through the options. Perineal body. The perineal body is muscular. Cervix. The cervix is separate. Uterus. The uterus is separate. And the correct answer is vagina. The Bartholin glands lie in the vaginal vestibule, the lower vagina. So, the right answer is option D. Vagina. Question 45. Breath holding spells characteristically disappear by Option A, 4 to 8 years. Option B, 1 year. Option C, 12 years. Option D, adolescence. The correct answer is option A, 4 to 8 years. Let's go through the options. 1 year. They persist beyond 1 year. 12 years. They are usually gone before 12. Adolescence. They do not last into adolescence. And the correct answer is 4 to 8 years. Breath holding spells resolve by about 4 to 8 years. So, the right answer is option A. 4 to 8 years. Question 46. A child is able to say tata and bye-bye at about Option A, 7 months. Option B, 3 months. Option C, 18 months. Option D, 24 months. The correct answer is option A, 7 months. Let's go through the options. 3 months. 3 months is too early. 18 months. 18 months is later. 24 months. 24 months is later. And the correct answer is 7 months. A child waves bye-bye at about 7 to 9 months. So, the right answer is option A. 7 months. Question 47. Congenital adrenal hyperplasia most commonly results from a defect in Option A, androgen deficiency. Option B, aldosterone excess. Option C, cortisol synthesis. Option D, thyroid synthesis. The correct answer is option C, cortisol synthesis. Let's go through the options. Androgen deficiency. Androgen deficiency is not the primary defect. Aldosterone excess. Aldosterone excess is not it. Thyroid synthesis. Thyroid synthesis is unrelated. And the correct answer is cortisol synthesis. Congenital adrenal hyperplasia is a defect in cortisol synthesis, usually 21-hydroxylase. So, the right answer is option C. Cortisol synthesis. Question 48. A child is legally considered able to take part in decisions at about Option A, 7 years. Option B, 3 years. Option C, 12 years. Option D, 16 years. The correct answer is option A, 7 years. Let's go through the options. 3 years. 3 is too young. 12 years. 12 is later. 16 years. 16 is later. And the correct answer is 7 years. A child can take part in simple decisions at about 7 years. So, the right answer is option A. 7 years. Question 49. Precocious sexual characteristics in a 2-year-old suggest a lesion of the Option A, pituitary only. Option B, thyroid. Option C, adrenal gland. Option D, gonad only. The correct answer is option C, adrenal gland. Let's go through the options. Pituitary only. A pituitary lesion gives central precocity, less likely at this age. Thyroid. The thyroid is unrelated. Gonad only. A gonadal lesion alone is less likely. And the correct answer is adrenal gland. An androgen-secreting adrenal lesion causes precocious features in a young child. So, the right answer is option C. Adrenal gland. Question 50. Passive antibody transferred from mother protects the infant mainly against. Option A, rotavirus. Option B, Haemophilus influenzae. Option C, measles only. Option D, tetanus only. The correct answer is option B, Haemophilus influenzae. Let's go through the options. Rotavirus. Rotavirus immunity is not mainly from maternal antibody. Measles only. Protection is not limited to measles only. Tetanus only. It is not tetanus only. And the correct answer is Haemophilus influenzae. Maternal antibody gives the infant early protection, including against Haemophilus. So, the right answer is option B. Haemophilus influenzae. Question 51. Breast milk compared with bottle feed is more likely to cause. Option A, vomiting. Option B, diarrhea. Option C, constipation. Option D, colic only. The correct answer is option C, constipation. Let's go through the options. Vomiting. Vomiting is not more likely. Diarrhea. Breast milk gives looser stools, not more diarrhea. Colic only. Colic is not more likely. And the correct answer is constipation. The key marks constipation as more likely with breast milk. So, the right answer is option C. Constipation. Question 52. Eczema in an infant may be precipitated by. Option A, fluoride. Option B, vitamin D. Option C, iron drops. Option D, breast milk protein. The correct answer is option D, breast milk protein. Let's go through the options. Fluoride. Fluoride does not cause eczema. Vitamin D. Vitamin D does not. Iron drops. Iron drops do not. And the correct answer is breast milk protein. The key marks breast milk protein via maternal dairy as the trigger. So, the right answer is option D. Breast milk protein. Question 53. Prominent occiput is not a feature of. Option A, Pato syndrome. Option B, Edwards syndrome. Option C, Down syndrome. Option D, Turner syndrome. The correct answer is option C, Down syndrome. Let's go through the options. Pato syndrome. Pato syndrome has other features. Edwards syndrome. Edwards syndrome has a prominent occiput. Turner syndrome. Turner syndrome is unrelated. And the correct answer is Down syndrome. Down syndrome has a flat occiput, so it is the exception. So, the right answer is option C. Down syndrome. Question 54. A ball of the external auditory canal is very painful because Option A. There is no nerve supply. Option B. The canal is wide. Option C. The skin is closely adherent to underlying tissue and richly supplied. Option D. The skin is loose. The correct answer is option C. The skin is closely adherent to underlying tissue and richly supplied. Let's go through the options. There is no nerve supply. There is a nerve supply. The canal is wide. The canal is narrow, not wide. The skin is loose. The skin is tight, not loose. And the correct answer is the skin is closely adherent to underlying tissue and richly supplied. The canal skin is closely adherent to cartilage and richly innervated, so swelling is very painful. So, the right answer is option C. The skin is closely adherent to underlying tissue and richly supplied. Question 55. Rupture of the tympanic membrane during syringing is suspected if there is Option A. Tinnitus alone. Option B. Painless discharge. Option C. Improved hearing. Option D. Excessive pain, vertigo and blood-tinged fluid. The correct answer is option D. Excessive pain, vertigo and blood-tinged fluid. Let's go through the options. Tinnitus alone. Tinnitus alone is not diagnostic. Painless discharge. The discharge is not painless here. Improved hearing. Hearing does not improve. And the correct answer is excessive pain, vertigo and blood-tinged fluid. Excessive pain, vertigo and blood-tinged fluid suggest a perforation. So, the right answer is option D. Excessive pain, vertigo and blood-tinged fluid. Question 56. Adenoid hypertrophy in an infant characteristically causes Option A. Hoarseness. Option B. Mouth breathing and feeding difficulty. Option C. Stridor only. Option D. Dysphagia only. The correct answer is option B. Mouth breathing and feeding difficulty. Let's go through the options. Hoarseness. Hoarseness is laryngeal. Stridor only. Stridor alone is not it. Dysphagia only. Dysphagia alone is not it. And the correct answer is mouth breathing and feeding difficulty. Adenoids block the nose, causing mouth breathing and feeding difficulty. So, the right answer is option B. Mouth breathing and feeding difficulty. Question 57. The commonest complication of mastoidectomy is Option A. Vertigo. Option B. Meningitis. Option C. Deafness. Option D. Facial palsy. The correct answer is option D. Facial palsy. Let's go through the options. Vertigo. Vertigo is possible but not commonest. Meningitis. Meningitis is serious but less common. Deafness. Deafness can occur. And the correct answer is facial palsy. Facial nerve palsy is the commonest complication of mastoidectomy. So, the right answer is option D. Facial palsy. Question 58. Persistent CSF rhinorrhea suggests fracture of the Option A. Middle cranial fossa. Option B. Anterior cranial fossa. Option C. Posterior fossa. Option D. Mandible. The correct answer is option B. Anterior cranial fossa. Let's go through the options. Middle cranial fossa. A middle fossa fracture gives CSF arteria. Posterior fossa. The posterior fossa is unrelated. Mandible. The mandible is unrelated. And the correct answer is anterior cranial fossa. CSF rhinorrhea suggests an anterior cranial fossa, cribriform fracture. So, the right answer is option B. Anterior cranial fossa. Question 59. The stapedius reflex is tested by option A. Weber test. Option B. Pure tone audiometry. Option C. Rinner test. Option D. Impedance audiometry. The correct answer is option D. Impedance audiometry. Let's go through the options. Weber test. The Weber test compares ears. Pure tone audiometry. Pure tone audiometry tests thresholds. Rinner test. The Rinner test compares conduction. And the correct answer is impedance audiometry. The stapedius reflex is tested by impedance audiometry. So, the right answer is option D. Impedance audiometry. Question 60. The caloric test is contraindicated in option A. Vertigo. Option B. Tympanic membrane perforation. Option C. Tinnitus. Option D. Otosclerosis. The correct answer is option B. Tympanic membrane perforation. Let's go through the options. Vertigo. Vertigo is an indication, not a contraindication. Tinnitus. Tinnitus is not. Otosclerosis. Otosclerosis is not. And the correct answer is tympanic membrane perforation. A perforated tympanic membrane contraindicates water caloric testing. So, the right answer is option B. Tympanic membrane perforation. Question 61. Functional endoscopic sinus surgery is abbreviated as option A. FES. Option B. FEES. Option C. FNSS. Option D. ESSF. The correct answer is option A. FES. Let's go through the options. FEES. FEES is a swallow study. FNSS. FNSS is not a term. ESSF. ESSF is not a term. And the correct answer is FES. FES stands for Functional Endoscopic Sinus Surgery. So, the right answer is option A. FES. Question 62. Perilymph is contained in the option A. Endolymphatic sac. Option B. Scala media. Option C. Cochlear duct. Option D. Scala vestibuli and scala tympani. The correct answer is option D. Scala vestibuli and scala tympani. Let's go through the options. Endolymphatic sac. The endolymphatic sac holds endolymph. Scala media. The scala media holds endolymph. Cochlear duct. The cochlear duct holds endolymph. And the correct answer is scala vestibuli and scala tympani. Perilymph fills the scala vestibuli and the scala tympani. So, the right answer is option D. Scala vestibuli and scala tympani. Question 63. Chronic beclomethasone use predisposes to option A. Neuropathy. Option B. Nephrolithiasis. Option C. Hepatitis. Option D. Osteoporosis. The correct answer is option D, osteoporosis. Let's go through the options. Neuropathy. Neuropathy is not typical. Nephrolithiasis. Stones are not typical. Hepatitis. Hepatitis is not typical. And the correct answer is osteoporosis. Chronic steroid use predisposes to osteoporosis. So, the right answer is option D. Osteoporosis. Question 64. Thiazide diuretics characteristically cause. Option A, hypercalcia. Option B, hyperuricemia. Option C, hyperkalemia. Option D, metabolic acidosis. The correct answer is option B, hyperuricemia. Let's go through the options. Hypercalcia. Thiazides cause hypocalcia, not hyper. Hyperkalemia. They cause hypokalemia, not hyperkalemia. Metabolic acidosis. They cause an alkalosis, not acidosis. And the correct answer is hyperuricemia. Thiazides cause hyperuricemia and gout. So, the right answer is option B. Hyperuricemia. Question 65. The most potent cycloplegic drug is. Option A, atropine. Option B, tropicamide. Option C, cyclopentolate. Option D, homatropine. The correct answer is option A, atropine. Let's go through the options. Tropicamide. Tropicamide is short-acting. Cyclopentolate. Cyclopentolate is intermediate. Homatropine. Homatropine is weaker than atropine. And the correct answer is atropine. Atropine is the most potent and longest-acting cycloplegic. So, the right answer is option A. Atropine. Question 66. Atropine is contraindicated in. Option A, closed-angle glaucoma. Option B, open-angle glaucoma. Option C, uveitis. Option D, conjunctivitis. The correct answer is option A, closed-angle glaucoma. Let's go through the options. Open-angle glaucoma. Open-angle glaucoma is less affected. Uveitis. Uveitis actually uses atropine. Conjunctivitis. Conjunctivitis is unrelated. And the correct answer is closed-angle glaucoma. Atropine dilates the pupil and can precipitate closed-angle glaucoma. So, the right answer is option A. Closed-angle glaucoma. Question 67. Gentamicin should be avoided in. Option A, cardiac failure. Option B, hepatic failure. Option C, renal failure. Option D, anemia. The correct answer is option C, renal failure. Let's go through the options. Cardiac failure. Cardiac failure is not the key issue. Hepatic failure. Hepatic failure is not the key issue. Anemia. Anemia is unrelated. And the correct answer is renal failure. Gentamicin is nephrotoxic and accumulates in renal failure. So, the right answer is option C. Renal failure. Question 68. Nephrotoxicity is most characteristic of. Option A, metronidazole. Option B, penicillin. Option C, erythromycin. Option D, gentamicin. The correct answer is option D, gentamicin. Let's go through the options. Metronidazole. Metronidazole is not nephrotoxic. Penicillin? Penicillin is not. Erythromycin? Erythromycin is not. And the correct answer is gentamicin. Gentamicin is characteristically nephrotoxic. So, the right answer is option D. Gentamicin. Question 69. Pancreatic secretion is inhibited by option A. Gastrin, option B. Secretin, option C. cholecystokinin, option D. glucagon. The correct answer is option D. Glucagon. Let's go through the options. Gastrin. Gastrin stimulates acid. Secretin. Secretin stimulates bicarbonate. Cholecystokinin. Cholecystokinin stimulates enzymes. And the correct answer is glucagon. Glucagon inhibits pancreatic secretion. So, the right answer is option D. Glucagon. Question 70. Dextran interferes with option A. Factor 8, option B. Fibrinogen synthesis, option C. Vitamin K, option D. Platelet function. The correct answer is option D. Platelet function. Let's go through the options. Factor 8. It does not directly affect factor 8. Fibrinogen synthesis. Not fibrinogen synthesis. Vitamin K. Not vitamin K. And the correct answer is platelet function. Dextran impairs platelet function. So, the right answer is option D. Platelet function. Question 71. Halothane sensitizes the myocardium to option A. Potassium, option B. Catecholamines, option C. Calcium, option D. Magnesium. The correct answer is option B. Catecholamines. Let's go through the options. Potassium. Not potassium. Calcium. Not calcium. Magnesium. Not magnesium. And the correct answer is catecholamines. Halothane sensitizes the myocardium to catecholamines, risking arrhythmias. So, the right answer is option B. Catecholamines. Question 72. The avascular structure of the eye is the option A. Choroid, option B. Lens, option C. Iris, option D. Retina. The correct answer is option B. Lens. Let's go through the options. Choroid. The choroid is highly vascular. Iris. The iris is vascular. Retina. The retina is vascular. And the correct answer is lens. The lens is avascular, nourished by aqueous. So, the right answer is option B. Lens. Question 73. Bitot spots are associated with deficiency of option A. Vitamin B12, option B. Vitamin C, option C. Vitamin D, option D. Vitamin A. The correct answer is option D. Vitamin A. Let's go through the options. Vitamin B12. Vitamin B12 deficiency causes anemia. Vitamin C. Vitamin C causes scurvy. Vitamin D. Vitamin D causes rickets. And the correct answer is vitamin A. Bitot spots are a sign of vitamin A deficiency. So, the right answer is option D. Vitamin A. Question 74. Steroid-induced glaucoma is also known as Option A. Malignant glaucoma. Option B. Congenital glaucoma. Option C. 100-day glaucoma. Option D. Pigmentary glaucoma. The correct answer is option C. 100-day glaucoma. Let's go through the options. Malignant glaucoma. Malignant glaucoma is a different entity. Congenital glaucoma. Congenital glaucoma is in infants. Pigmentary glaucoma. Pigmentary glaucoma is a separate type. And the correct answer is 100-day glaucoma. Steroid-induced glaucoma is called 100-day glaucoma. So, the right answer is option C. 100-day glaucoma. Question 75. Aqueous humor is secreted by the Option A. Cornea. Option B. Iris. Option C. Lens. Option D. Ciliary body. The correct answer is option D. Ciliary body. Let's go through the options. Cornea. The cornea does not secrete it. Iris. The iris does not. Lens. The lens does not. And the correct answer is ciliary body. The ciliary body secretes aqueous humor. So, the right answer is option D. Ciliary body. Question 76. The most accurate method of measuring intraocular pressure is Option A. Digital palpation. Option B. Applanation tonometry. Option C. Indentation tonometry. Option D. Non-contact tonometry. The correct answer is option B. Applanation tonometry. Let's go through the options. Digital palpation. Digital palpation is crude. Indentation tonometry. Indentation is less accurate. Non-contact tonometry. Non-contact is a screening tool. And the correct answer is applanation tonometry. Applanation tonometry is the most accurate method. So, the right answer is option B. Applanation tonometry. Question 77. Congenital glaucoma is treated surgically by Option A. Goniotomy. Option B. Trabeculectomy. Option C. Iridotomy. Option D. Cyclocryotherapy. The correct answer is option A. Goniotomy. Let's go through the options. Trabeculectomy. Trabeculectomy suits adults. Iridotomy. Iridotomy is for angle closure. Cyclocryotherapy. Cyclocryotherapy is a last resort. And the correct answer is goniotomy. Goniotomy opens the drainage angle in congenital glaucoma. So, the right answer is option A. Goniotomy. Question 78. Lagophthalmos results from palsy of which cranial nerve? Option A. 5th. Option B. 3rd. Option C. 7th. Option D. 6th. The correct answer is option C. 7th. Let's go through the options. 5th. The 5th nerve is sensory to the face. 3rd. The 3rd moves the eye and lid. 6th. The 6th abducts the eye. And the correct answer is 7th. A facial, 7th, nerve palsy prevents lid closure, causing lagophthalmos. So, the right answer is option C. 7th. Question 79. Enucleation is indicated in Option A. Chalazion. Option B, simple cataract. Option C, sympathetic ophthalmia and painful blind eye. Option D, pterygium. The correct answer is option C, sympathetic ophthalmia and painful blind eye. Let's go through the options. Chalazion. A chalazion is minor. Simple cataract. A cataract is removed by lens surgery. Pterygium. A pterygium is simply excised. And the correct answer is sympathetic ophthalmia and painful blind eye. Enucleation is indicated for sympathetic ophthalmia and a painful blind eye. So, the right answer is option C. Sympathetic ophthalmia and painful blind eye. Question 80. A keratin horn is best described as. Option A. A papilloma with excess keratin formation. Option B. A malignant ulcer. Option C. A sebaceous cyst. Option D. A viral wart only. The correct answer is option A. A papilloma with excess keratin formation. Let's go through the options. A malignant ulcer. It is not a malignant ulcer. A sebaceous cyst. Not a sebaceous cyst. A viral wart only. Not only a viral wart. And the correct answer is a papilloma with excess keratin formation. A cutaneous horn is a papilloma with excess keratin. So, the right answer is option A. A papilloma with excess keratin formation. Question 81. The blue nevus is characteristically. Option A, benign. Option B, malignant. Option C, premalignant. Option D, metastatic. The correct answer is option A, benign. Let's go through the options. Malignant. It is not malignant. Premalignant. Not premalignant. Metastatic. Not metastatic. And the correct answer is benign. A blue nevus is benign. So, the right answer is option A. Benign. Question 82. Hepatoma is most commonly. Option A, malignant. Option B, benign. Option C, premalignant. Option D, inflammatory. The correct answer is option A, malignant. Let's go through the options. Benign. It is not benign. Premalignant. Not merely premalignant. Inflammatory. Not inflammatory. And the correct answer is malignant. A hepatoma, hepatocellular carcinoma, is malignant. So, the right answer is option A. Malignant. Question 83. An antibioma is. Option A. A benign tumor. Option B. A drug reaction. Option C. A mass of fibrous tissue around a persistently treated abscess. Option D. A granuloma. The correct answer is option C. A mass of fibrous tissue around a persistently treated abscess. Let's go through the options. A benign tumor. It is not a benign tumor. A drug reaction. Not a drug reaction. A granuloma. Not a granuloma. And the correct answer is a mass of fibrous tissue around a persistently treated abscess. An antibioma is a fibrous mass around a persistently treated abscess. So, the right answer is option C. A mass of fibrous tissue around a persistently treated abscess. Question 84. Implantation cysts arise from. Option A. Persistence of epithelial cells after wound healing. Option B. Blocked ducts. Option C. Trauma to fat. Option D. Lymphatic obstruction. The correct answer is option A. Persistence of epithelial cells after wound healing. Let's go through the options. Blocked ducts. Blocked ducts give retention cysts. Trauma to fat. Fat trauma gives fat necrosis. Lymphatic obstruction. Lymphatic obstruction gives lymphedema. And the correct answer is persistence of epithelial cells after wound healing. An implantation cyst forms from epithelial cells buried after a wound. So, the right answer is option A. Persistence of epithelial cells after wound healing. Question 85. Basal cell carcinoma least commonly spreads by. Option A. Perineural route. Option B. Direct invasion. Option C. Local extension. Option D. Lymphatics. The correct answer is option D. Lymphatics. Let's go through the options. Perineural route. It can track along nerves. Direct invasion. It invades directly. Local extension. It extends locally. And the correct answer is lymphatics. Basal cell carcinoma rarely spreads by lymphatics, so this is the least. So, the right answer is option D. Lymphatics. Question 86. Blood for transfusion should be stored at. Option A. 2 to 6 degrees Celsius. Option B. 0 degrees Celsius. Option C. 10 to 15 degrees Celsius. Option D. Room temperature. The correct answer is option A. 2 to 6 degrees Celsius. Let's go through the options. 0 degrees Celsius. 0 degrees would freeze and hemolyze it. 10 to 15 degrees Celsius. 10 to 15 is too warm. Room temperature. Room temperature is unsafe. And the correct answer is 2 to 6 degrees Celsius. Blood is stored at 2 to 6 degrees Celsius. So, the right answer is option A. 2 to 6 degrees Celsius. Question 87. Platelets must be transfused within about. Option A. 6 to 8 hours. Option B. 24 hours. Option C. 48 hours. Option D. 72 hours. The correct answer is option A. 6 to 8 hours. Let's go through the options. 24 hours. 24 hours is longer than ideal. 48 hours. 48 is too long. 72 hours. 72 is too long. And the correct answer is 6 to 8 hours. Platelets should be transfused within about 6 to 8 hours once issued. So, the right answer is option A. 6 to 8 hours. Question 88. Simple pyrexia after transfusion is most often due to. Option A. ABO mismatch. Option B. Bacterial contamination. Option C. Donor apparatus. Option D. Volume overload. The correct answer is option C. Donor apparatus. Let's go through the options. ABO mismatch. An ABO mismatch gives a severe reaction, not simple pyrexia. Bacterial contamination. Bacterial contamination gives sepsis. Volume overload. Volume overload gives breathlessness. And the correct answer is donor apparatus. Simple pyrexia is usually from pyrogens in the donor apparatus. So, the right answer is option C. Donor apparatus. Question 89. Each 1 degree Celsius rise in temperature increases water loss by about. Option A, 150 milliliters. Option B, 50 milliliters. Option C, 500 milliliters. Option D, 1000 milliliters. The correct answer is option A, 150 milliliters. Let's go through the options. 50 milliliters. 50 is too little. 500 milliliters. 500 is too much. 1000 milliliters. 1000 is far too much. And the correct answer is 150 milliliters. Each degree Celsius rise adds about 150 milliliters of water loss. So, the right answer is option A. 150 milliliters. Question 90. The daily sodium requirement in a surgical patient is about. Option A, 100 mol. Option B, 20 mol. Option C, 250 mol. Option D, 400 mol. The correct answer is option A, 100 mol. Let's go through the options. 20 mol. 20 is too little. 250 mol. 250 is too much. 400 mol. 400 is far too much. And the correct answer is 100 mol. The daily sodium requirement is about 100 millimoles. So, the right answer is option A. 100 mol. Question 91. Decreased mass movement in the colon results from damage to the. Option A, Orbach plexus. Option B, Meissner plexus. Option C, vagus only. Option D, sympathetic chain. The correct answer is option A, Orbach plexus. Let's go through the options. Meissner plexus. The Meissner plexus controls secretion. Vagus only. The vagus alone is not it. Sympathetic chain. The sympathetic chain inhibits, not drives, motility. And the correct answer is Orbach plexus. Damage to the Orbach, myenteric, plexus reduces colonic mass movements. So, the right answer is option A. Orbach plexus. Question 92. Lymphokines are produced mainly by. Option A, platelets. Option B, B lymphocytes. Option C, neutrophils. Option D, T lymphocytes. The correct answer is option D, T lymphocytes. Let's go through the options. Platelets. Platelets release clotting mediators. B lymphocytes. B lymphocytes make antibody. Neutrophils. Neutrophils phagocytose. And the correct answer is T lymphocytes. Lymphokines are produced mainly by T lymphocytes. So, the right answer is option D. T lymphocytes. Question 93. Memory cells of the immune system are. Option A, B lymphocytes. Option B, neutrophils. Option C, monocytes. Option D, eosinophils. The correct answer is option A, B lymphocytes. Let's go through the options. Neutrophils. Neutrophils are short-lived. Monocytes. Monocytes are not memory cells. Eosinophils. Eosinophils are not. And the correct answer is B. Lymphocytes. Memory cells are long-lived B lymphocytes. So, the right answer is option A. B. Lymphocytes. Question 94. Blood flow to the myocardium occurs mainly during option A. Diastole. Option B. Systole. Option C. Isovolumetric contraction. Option D. Ejection phase. The correct answer is option A. Diastole. Let's go through the options. Systole. In systole, the vessels are compressed. Isovolumetric contraction. Isovolumetric contraction compresses them. Ejection phase. The ejection phase compresses them. And the correct answer is diastole. The coronary arteries fill mainly during diastole. So, the right answer is option A. Diastole. Question 95. The internal carotid artery has no branches in the option A. Neck. Option B. Cavernous sinus. Option C. Petrous canal. Option D. Cranial cavity. The correct answer is option A. Neck. Let's go through the options. Cavernous sinus. It branches in the cavernous sinus. Petrous canal. It has petrous branches. Cranial cavity. It branches in the cranial cavity. And the correct answer is neck. The internal carotid gives no branches in the neck. So, the right answer is option A. Neck. Question 96. The submandibular gland contributes about what proportion of resting saliva? Option A. 70%. Option B. 20%. Option C. 40%. Option D. 90%. The correct answer is option A. 70%. Let's go through the options. 20%. 20% is roughly the parotid share at rest. 40%. 40 is not correct. 90%. 90 overstates it. And the correct answer is 70%. The submandibular gland gives about 70% of resting saliva. So, the right answer is option A. 70%. Question 97. Removal of the submandibular gland risks injury to which nerve? Option A. Vagus. Option B. Facial trunk. Option C. Hypoglossal. Option D. Accessory. The correct answer is option C. Hypoglossal. Let's go through the options. Vagus. The vagus is not at risk here. Facial trunk. The facial trunk is not, though its marginal branch is. Accessory. The accessory is not. And the correct answer is hypoglossal. The hypoglossal nerve lies deep to the gland and is at risk. So, the right answer is option C. Hypoglossal. Question 98. The diaphragm receives its motor supply from nerve roots. Option A. C3, C4 and C5. Option B. C1 and C2. Option C. T1 and T2. Option D. C6 and C7. The correct answer is option A. C3, C4 and C5. Let's go through the options. C1 and C2. C1 and C2 are too high. T1 and T2. T1 and T2 are too low. C6 and C7. C6 and C7 are wrong. And the correct answer is C3, C4 and C5. The phrenic nerve C3, C4 and C5 supplies the diaphragm. So, the right answer is option A. C3, C4 and C5. Question 99. Glycosylated hemoglobin is used to assess. Option A. Acute hyperglycemia. Option B. Long-term glycemic control. Option C. Insulin levels. Option D. Renal function. The correct answer is option B. Long-term glycemic control. Let's go through the options. Acute hyperglycemia. It does not reflect acute hyperglycemia. Insulin levels. It does not measure insulin. Renal function. It does not measure renal function. And the correct answer is long-term glycemic control. Glycosylated hemoglobin reflects long-term glycemic control. So, the right answer is option B. Long-term glycemic control. Question 100. The liver is unable to synthesize. Option A. Fibrinogen. Option B. Albumin. Option C. Gamma globulin. Option D. Prothrombin. The correct answer is option C. Gamma globulin. Let's go through the options. Fibrinogen. The liver makes fibrinogen. Albumin. It makes albumin. Prothrombin. It makes prothrombin. And the correct answer is gamma globulin. Gamma globulins are made by plasma cells, not the liver. So, the right answer is option C. Gamma globulin.